The Crooked Tree Health Center, situated near the entrance to the village, has been closed off to residents indefinitely. The notice came after a portion of the veranda to the upper flat collapsed to the ground. Luckily, it wasn't a clinic day, so residents were not lined up underneath, thereby avoiding being crushed by the concrete debris. Sherna Dolphus says that her 6-year-old son, Abraham Dawson, was playing below when the veranda gave way.
I made the sit down in my sofa, and my mind just run for Abraham, and I holla for Abraham. When I holla for Abraham, I see Abraham jump like when I jump hopscotch, right? And I jump up, and when I jump up, I hear like a screaming over, yeah, but the man who live up, the nurse husband. And when I look, I see the veranda broke down, and my son run for arm there. When he done broke down,
So he was nearly crushed by it.
yes, by the veranda for the Cookie Tree Health Center.
Adolphus says that the back step to the upper flat was rebuilt because it collapsed before the veranda did, but the building remains a hazard. The posts are brittle and breaking away, and the roofing to the veranda is in bad shape with cracks on the walls. Regional manager for the Central Health Region, Dr. Javier Zuniga, says that the structure was improperly built over 3 decades ago.
Unfortunately, from the onset, from when that building was erected, it wasn't built properly, and it was built poorly. The materials that were used were not appropriate at that time. The building itself has about 30 years now, and little by little it has been deteriorating. We are aware of the situation. What we have been trying to do was to get an engineer to look at the building to assess if the building was safe or not. Unfortunately, it was difficult to identify some funds to get that done, and the end part of the veranda, upstairs veranda, fell yesterday, which we are also aware of.
Dr. Zuniga says that an assessment of the damages has been done. The facility has been closed and the services have been moved to another building located in front of the health center. The upper flat of the building is occupied by the resident nurse and her family, and Dr. Zuniga says that even though they are strapped for cash, the building will be repaired or replaced.
The services that we offer there are primary health care services. It is run by a rural health nurse, and we see both services for family and community health primarily, but we also have medical services that are also attended to there. We have a schedule for mobile clinics, and that is done at least once a month in that village, and that is to see any medical conditions and also chronic patients in that community. So the services will not stop. The services will just be moved temporarily until we can get the building assessed and then repair if needed, or if we cannot use the building, then we'll have to find another option for the time being.
Duane, Moody for News 5.